The adventures here at Head Start have been wonderful. We've had our grandchildren go through here. The staff here is absolutely wonderful. They go above and beyond the call of duty.
When Jamie would come in, she would, work with Cadence with like her letters, her numbers, colors, shapes. Jamie was a big part of my daughter learning how to walk. She helped us teach her to walk, helped us teach her to crawl. I mean, everything. Helped us with her, getting her to talk, because she wouldn't talk. She helped us a lot. My daughter has congenital heart disease, and it's been a long haul. And had it not been for her home visits from early Head Start, she probably would not have been ready for school.
We serve pregnant women and families with children from birth to 5. And primarily it's families who are living in poverty, many of whom are homeless, some who have children with disabilities. And we do have some families that we serve who are over income, who are above that 100% of poverty as well. We work with families every day who are struggling to make ends meet. And like all parents, what they want for their children is to succeed in school and in life. And our job, as we see it, is to help them do that. And so we become partners in that process with them. And we do that through educational programs. So we have classrooms, we have home visits, but we also do that by providing comprehensive services. We have health specialists who do screenings for children. They will help find medical homes, so places where children can get medical care or dental care when they need it. We have family workers who work with families around social service kinds of issues. They will start with a family and work with the family's strengths and then build on those to work toward goals that the families have set for themselves. And the family workers and the home visitors are great resources to families to help them meet those goals. We also have mental health workers, and so the mental health workers will do assessments for children as well as for parents, and then help those families find the resources they need to meet the needs of their family out in the community.
Head Start differs from other preschool programs because we offer the whole package. We offer the health, the social service, and the education. And especially with Head Start, we involve the parents in the educational process. So parents give their input on what they want to see happening in the classroom. Maybe there's something that's going on at home and they can offer that information and it can be presented in the classroom through literature or conversations. Parents are an important part because they attend regular monthly educational committee meetings, and that's where that information is discussed.
I like to try to come in and help out in the classroom when I can. I love to help chaperone on the field trips. The field trips are absolutely wonderful. And just being in the classrooms and around the children is a blessing.
Also, we use field trips to support the education experience. We know that children learn more through experience, so we want to provide a lot of good opportunities for field trips, and of course we encourage parents to participate. We absolutely believe that parents are the children's first teacher, and we want to capitalize on that. We want to make sure that the parents know that we support them in their decisions and how they're going to educate their children. Another important thing that we do at Head Start is our outdoor learning environments. Most people call those playgrounds, but we call them outdoor learning environments because this is a place where we can expand on the curriculum, but doing it outside. And our children need to be outside. It's a good place for them to be. It's healthy for them to be outside. So we want to take our science and we want to do it outside. We want to have gross motor. We want to play on the playground, but we want to incorporate it all. So it's not just learning takes place in the classroom behind a desk, because that's not what's appropriate in today's time.
For infants and toddlers, we offer services so that parents can get back into the work field, so that they can concentrate on their working skills and feel confident that their children are being well cared for by a staff that is very well qualified. And we have primary caregivers for the children. The children are getting quality care. They're getting all domains are being satisfied. Personal, social domains. They're getting their language development, fine motor, gross motor, cognitive development, and parents can feel happy and secure that their children are being well cared for.
Head Start has been great. My daughter transitioned extremely well. She loves coming to school. She loves her teachers. She loves her friends. Everybody makes her feel comfortable, as well as myself. I feel very safe letting her come here, knowing that she's in good hands. I'm learning office skills. I'm actually learning to be more independent myself and reach out to people. And Norwescap has made me want to do something with myself. And I'm now studying to get my GED. And after my GED, I plan on taking online courses for early childhood development and psychology.
Parents can either be qualified or come into our combo program, where the children are in the classroom twice a week for 3 hours a day while the parents are in working or in training. And then our other option is our socialization program, where a home visitor comes out into the house and into the home environment. The parent works along with the parent and the child for an hour and a half each week, doing developmental activities, providing social services for the parents, providing all kinds of developmental activities for the children. They work together on the activities, and then the child has an opportunity once a week to come into the classroom and get socialization and interact with other children while the parents are interacting with other parents.
At this point, our funded enrollment is 498 children. Norwescap Head Start has been operating since 1965, so we have a very long history. In 1995, Early Head Start was created on a national level, and Norwescap was one of the first programs to receive an Early Head Start grant. So we've been serving pregnant women and infants and toddlers since that time. The program that began in 1965 was for preschoolers and actually began as a summer program, developed into a more year-round program, and that serves preschoolers. Head Start has been a community program from the very beginning. It was developed that way, and so we really count on the community to help us, particularly to match our federal dollars that we receive. We're required to match that with community dollars, whether it's monetary donations or it's donations of services and supplies. So we are always very appreciative of anything that the community can contribute to help us operate. And we're also always looking to make sure that we're serving the families that need us. So we love when community members would know about Head Start and share that with the people who need the services, so that we make sure that we can give them to them. We are certainly hoping that we're going to be around for a long time in Northwest New Jersey. And we will be providing programs that meet the needs of the community. We do a community assessment every 3 years, and we look at what needs there are in the community and how we can best meet those needs. And so we will certainly continue to do that.
Norwescap has been the best thing for my life and my children's life that I could imagine.
Families are certainly invited to call our administrative office, and that number is 908-454-8830. They can also go on the Norwescap website, which is www.norwescap.org, and there is a preliminary application on there that can be completed, and then someone from Head Start would be in touch with them to complete a more extensive application. We're located in 4 counties in Northwest New Jersey, in Warren, Sussex, Morris, and Hardin.